Next, we'll move to some items of information. And first, we have the 2019 Annual Ann Arbor Public Schools Testing for Lead in Drinking Water Program report. Dr. Swift.
Thank you. Vice President Johnson and trustees, you very well recall that we did a tremendous amount of work back in the fall to ensure that our drinking water was absolutely as safe as possible. I want to just hit on some highlights of the work that we've done, and then we have Mr. Emil Lautzana, Mr. Marios Dumitru, and our water quality partner, Ms. Jenna Sendra from Arch Environmental. So we'll, in the second part, turn it over to them. As a part of all of the work we do to ensure student safety, trustees, you know that we attend to the health and well-being of all of our students and staff by ensuring, in one way, ensuring our drinking water is safe in schools. And I know this board stated strongly in the fall, and you've continued to reiterate, that we are committed to achieving the lowest possible levels of lead in drinking water in the Ann Arbor Public Schools, and we take very seriously the risks associated with lead exposure, particularly for our youngest children. So we, as you recall, trustees, have done several things. I want to highlight them, and then we'll move into the annual report. We have voluntarily tested water over 3 years, beginning in 2016 in the district, and we will share more details on that. But I want to share, trustees, that we've done more locations each year, and this year we tested every single drinking water location. The total on that is 1,426 samples. As a result of that, trustees, I do want to say publicly tonight that, that although late fall we had anticipated that we would wrap this up and be back to the community early in the year, it turns out that it's a pretty immense endeavor to test every single location in every school. So I will be right up front, trustees, that this report is coming just a little bit later than what we had originally planned, but I'm very proud of the work in that we did complete testing on every last location. All of the areas, part of what we did in the fall was to move the action level from 15 parts per billion down to 5 parts per billion. Of course, we want no lead in the water. 0 or non-detect is what we want to achieve. 5 parts per billion is the limit for bottled water. So we have settled on that for now in terms of action. At the same time, we've worked closely with the Washtenaw County Department of Health and with our experts in the field to ensure that we're using proper procedure and process. We have also installed hydration stations. They are actually filtered water bottle filling stations. You will see photos of them this evening, and I'm very proud to say, trustees, that we are at the level of having 2 of those stations, a minimum of 2 in every single school, and we have completed 17 schools with, I'm sorry, is it 24? Thank you. I knew I said that wrong. 24 schools at the 1/100 ratio. So we are a very good ways through our process, and keeping in mind that a single hydration station can take a day, for anywhere from a day to several days for a plumber to install, depending on the complexity of where it is located. We continue to flush all of our water systems following school breaks. You recall, trustees, that when water sits in the lines, that's when lead can accumulate. So we have continued the practice in a more strategic way and more consistent way to ensure that all of our areas are flushed after Thanksgiving, winter break, spring break, etc. We have completed the inventory of all of our water sources in the district, and you recall, trustees, that another dimension of our plan was to provide signage to every single non-designated drinking location. So that would be in a custodial closet. It might be I'm just trying to think of a few of those. You'll see them in the slideshow. But in those areas that we're notifying folks, don't drink this water. And we're making sure that everybody's aware of that. That signage installation will continue and be wrapped up over the summer. The testing for lead in drinking water program results, we promise trustees to report that annually. Tonight is the annual report. We will later this week make sure that every single parent in the Ann Arbor Public Schools has a personal email documenting the completion of the process and linking them right to where they can find their school's results. So we will continue the annual reporting as we've done over previous years and are now doing tonight for this year. And Vice President Johnson and members of the board, I would ask that the planning for next steps in our testing process, if you're willing, be remanded to planning committee. There is a little bit of a discussion to have there because testing does cost money. And so we'll talk about the various levels of testing, the frequency of testing. We know that this year we did the most vigorous testing that we've done. We're proud to have completed that, but we would appreciate working together with the board to determine our rhythm and our practice moving forward. I don't believe that's a board table discussion. I believe that's a committee discussion. So in the Ann Arbor Public Schools, we are committed to health and safety of our students, and testing for quality drinking water is one of the areas in which we work. I want to give a special shout out in this report this evening to Mr. Emil Lautsana, Ms. Jenna Sendra, and Mr. Marios Dimitriou, who back in the fall were very busy on many, many days, and they've been busy every day since then, making sure that we kept our promises, trustees. Every single promise we made, we kept. We ran a little bit longer than we anticipated, but we're pleased to have finished this project. And so with that, trustees, the team is happy to work you through the steps of what we've done and where we are today, and then we'll listen closely to your discussion and to your questions, because this is an area that we really are leading the way in, and we want to continue to do so. With that, Mr. Dimitriou. Very good. Mr. Lautsana.
Thank you, Dr. Swift. Good evening, Board of Education. So Dr. Swift covered a lot of the overview, and I'll kind of run through a couple slides that reinforce some of those points, and then we're available for questions and listening to your discussion. So we did it in three phases, the testing, and following the testing, then remediation began at these locations, starting with preschool and the elementaries. The second phase of elementaries over the winter break, and then the middle schools and high schools in February and April, and we're wrapping up some of the items from those tests. So this year we tested 1,426 locations. That's a lot of drinking locations. We have complete inventories now of all drinking and non-drinking locations. Each fixture has an individual ID number, and it's on a CAD map that PDF map. So anytime we have an issue or we do a test in the future, we know it's fixture D27 that we've tested, and that goes with the testing label and everything, so we know exactly where we are when we're doing things, when we're changing things out, etc. That'll be very valuable as we move forward with continuing this program. We did reduce the level to greater than 5 parts per billion, and at that level we've had 106 fixtures that were flagged for remediation. 13 of those are still out of service awaiting mitigation. On the hydration station front, we've installed 175 of those, and we have 45 left to be installed. So the The 13 fixtures that need mitigation and the 45 that are still pending for the summer, those are the more difficult to install fixtures that require the kinds of activities that are difficult to do during an operating school year, cutting open floors, breaking through walls, those kinds of things. So we'll get to those this summer. And then also this summer, we'll be putting signage on all non-potable sources. So places like art rooms, sinks, spigots outside of buildings, custodial closets, etc. So here's the summary of the hydration station. I like this picture in particular. One of our plumbers from Goyette Mechanical took this picture. The young man, the bell rang and he was supposed to go back to class, and he noticed the plumber was almost finished with the hydration station, and so he asked if he could be the first one to take a drink from that new water cooler. And he wanted to do so because the old one was recessed in the wall and was not handicap accessible, so he had never had a drink from that location in his school. So he got to be the first one to drink in the new hydration station. So here's our testing results. You can see on the left the parts per billion thresholds, and then our initial testing results. 1,307 of the fixtures came in below the action level. 85 were in that difference between the water bottle standard and the EPA standard, and then 34 were above the EPA standard, for a total of 1,426. Currently, as of, this is a moving target, so we picked a point in time, April 25th, to do all these numbers for you guys. We're down to only 13 fixtures remaining to be remediated. So those are offline. We're making corrections. They'll be retested, and if they pass the test, they'll be put back in service. If they don't, they'll stay offline, and we'll continue the remediation process. Our cost to date, Arch Environmental Group on testing, $143,000. Goyette Mechanical, $440,000. Other miscellaneous trades, that's things like masons, electricians, carpenters that are sometimes required, $46,000. Phoenix Contracting, project management, $45,000. And then Ferguson Enterprises, that's all of the hydration stations, piping, plumbing fixtures, etc., $249,000 for a total of $953,000. Given the complexity of the remaining installations, we estimate at the end of the summer, the number will be somewhere around $1.5 million for this program this year. So as Dr. Swift outlined, our next steps: complete the installation of the hydration stations, continue with the post-break flushing, install the do not drink signage, and then continue this program in the future as the board directs. Thank you.
So I will wrap up, trustees. Thank you, Mr. Lautzana. I will wrap up by sharing that I'm proud as superintendent to be able to say, and I know the board is, to be able to say that there are no drinking water locations operating in the district at any level greater than that of bottled water. And so we're proud of that. We want to continue to do more. We're also very much educating all of our stakeholders that if you want to absolutely ensure that you're at zero or at non-detect, to just be sure and use one of the many hydration stations, because that is the best source, although we have tested every water location, drinking water location this year. So I'm very proud of that progress, and I said this yesterday, I'll say it again. I love that question, are we where we want to be? Perhaps not quite. Are we where we were? Absolutely not. We're in a much significantly improved position this evening than we were just a few months ago. And I'm very anxious, trustees, to hear your questions and discussion, and then also to get with planning committee, or as the exec committee directs, get with the committee to determine our rhythm moving forward. It would be our recommendation to continue the testing throughout each school year. That has been the one. I know you all always want to hear the challenges and our recommendations based on our experience. And our experience tells us that we overwhelm the labs that are available. We overwhelm the team that's available when we try to do the entire district in one period of time during the year. So we would ask in our planning for future years, if we did 3 or 4 locations a month on a regular basis, and then report those results once a year to you all, but publish them as they come to schools. I believe that's a timeline and a rhythm that we could keep. And that, of course, is if the board wants to do annual. Of course, the other options is to do half each year or do a third each year. That certainly is up to our discussion. And whenever you all decide to meet on this topic, we'll be sure to have Ms. Sandra come along with us so she can give her opinion on that matter as well. And so with that, trustees, I thank you for your courageous leadership in authorizing the money for this project. I'm delighted to see that it came in at or below what was authorized in our fall vote, because at that time we just didn't know. It could have been a great deal more. So we're very grateful that it turned out that we had the money available. We were able to make the repairs. And so with that, Vice President and members of the board, we're ready for your questions.